All right, hi everybody. Right now we're all about helping guide doctors in implementing their brain-based exam into their practice for all ages, but definitely for pediatric population. So today, the one thing I want you to focus on and think about in your brain-based exam, some of you may have taken the CE course, the virtual course, and you're starting to go, okay, I want to implement some other things in. When you're doing your brain-based exam, when you're on the part where you're looking at maybe a few quick little primitive reflexes, you're looking at gross, you're observing gross motor, how is this kid walking to the exam room, looking at fine motor, how are they coloring, looking at eye movements. Again, you're not spending a whole bunch of time necessarily doing this. You're not changing your practice. You're confirming. You're getting more depth in your understanding of how subluxation impacts the trajectory of the brain. Actually, this helps you be more in chiropractic and helps you answer the tough questions and understand kind of the tough presentations of kids. So it is really important, just like it's important to have subluxation findings on your clinical exam, thermography, look at the pupils, look at posture, range of motion, palpation, leg checks, whatever you're doing there, which we have some things that we suggest. It's really important to also have some brain-based markers of how we're impacting the brain and specifically the developing brain. So today's tip is looking at when you are looking at a brain-based part of your exam, whether it's primitive reflexes or gross motor function, whatever it may be, I want you to make sure that you're not just looking quickly. You're not just looking for the first few seconds of gross motor function. You're looking at, can this child sustain that for, beyond 10 seconds? As we're looking at gross motor function, for example, we're observing how this child walks to the exam room, walks through your office. We want to see, is there a change from at first he's swinging his arms and he's having, good stability, and as he gets to, 10 seconds, he gets across the room, he's starting to be more wobbly, lose stability, have more of a lack of vestibular function, he gets more rigid and he's not swinging his arms. That's a window into, he may present on a test in the traditional sense of he has gross motor function, but neurologically he doesn't have much resilience to stress and he fatigues quickly. This is a kid that you may hear parents say something like, yeah, I don't know, he does really well at home with body control and with reading and with his siblings and with friends in small settings. And when he goes to school, we keep hearing from the teacher that he's really struggling with, reading or really struggling to control his body. And the parents are going, there's a mismatch. Well, that might be because we are having quick fatigue. That's really important. Again, on your brain-based exams, to understand how to monitor change as we're correcting subluxation and communicate to parents. If we didn't know how to communicate that, he does have good gross motor function, but he fatigues quickly, and when we correct subluxation, we're improving adaptability and resilience and communication and function in the nervous system, so we should see that he has more resilience and he doesn't fatigue as quickly as we go through care. We'll watch that on our re-exams. Then we'll continue to observe this, and we should see that changing, yes, in his life, but we should see it changing on our re-exams as well. We're not just saying, does he fit in the box or doesn't he? Does he have gross motor function ability or doesn't he or she? We're seeing, and does he have resilience? Do we see a fatiguing scenario happening? That's really important and so commonly missed on the brain-based exam. Okay? Start playing around with this in your exams. Maybe just pick one part of the brain-based exam that you're learning in our virtual CEs right now, or in the certification, and start bringing that one piece in so you can start to confidently develop your brain-based understanding of how subluxation impacts the brain, how to incorporate that in practice and communication, and help the families that need you now. All right, be well, do good work, help the families out there in your community.